Hi, nice to meet you.
Nice to meet you.
So, when and how did you know you wanted to work in healthcare?
When I was in high school, I was really enjoying science. I was a really good student, and I was thinking that probably one of my dreams will be to work in an area in healthcare.
Which opportunities have you encountered that confirmed you wanted that career?
One of that was that when I was growing up and I was a teenager, where close to the area where I was living, there was a lot of children, and they used to come to me every time I was going to my school. So I used to spend time with them. So then I started thinking about a career that I can take care of kids, like maybe a pediatric nurse. Also later on, when I noticed that my sister was studying to be a pharmacist and my brother to be a doctor, I was thinking that that can be really my passion in one of those areas, and probably nursing was more appealing to me at that time.
So, how many courses did you take in university and how did you keep up with them all?
At that time, there was 5 years to go to university, and they were 44 courses in total. And so for the first year was really hard because I have to organize my time and I have to study hard. I didn't have too much free time to spend with friends or family, so I decided even weekends it was a time to go ahead and prepare for the next week. And after the first year was done, I didn't realize the second year even will be much busier because I needed to go to the hospital in the mornings
To
as
do
a practice.
an internship?
Yeah. And then afternoon will be just only studies, my courses at the university. So mornings I learned how to take care of a patient, starting for simple things, even how to make a proper bed, and how to pay attention, how to listen to the patient, how to look at the patient, not only from the disease perspective, but like as a human being with feelings, with emotions, with different kind of needs. And I have really good instructors, so it was hard but exciting at the same time, right? So my goal was to be one of the best, but it was my own goal. Let's say I didn't want it wasn't a competition. I just wanted to be a good nurse.
So that was rewarding, but how was the application process for you?
So in Peru, you have to first decide which career you want to do. So in this case, it was a nursing career, and I have to take a test. So there was like a lot of applicants and not too many positions. So you have to prepare yourself quite a bit before entering into this test, which was a knowledge test of different areas, including math and science and chemistry and physics and literature and language, and also problem solving. So it was a lot of areas that you needed to study in order to take this test and enter to university. After this test was done, it was just a matter of registration and but also showing that you have you finish your high school, right, with good grades.
Yeah. Okay. And so after you graduated, you came to Canada, but between those years, after you graduated and came to Canada, what did you do in Peru?
I was working as a nurse in the community and with a doctor and an obstetrician in the rural areas in the highlands in Peru, and it was like a small community where services was available pretty much 24 hours if in case of any emergency. So if a woman was in labor, we needed to go 2 a.m. in the morning, 3 a.m. in the morning with the obstetrician to help this lady, and I will be taking care of the kids, of the newborn baby. And so that was a really interesting area, and also the doctor was really good in the way that he wanted to serve people from farther areas where there was not any healthcare services. So we used to carry our vaccines and medicine and sometimes travel by bus or walking after that to reach the area to be able to give education and to be able to give medicine.
Mm-hmm.
Later on, I was able to start working in a hospital in the endoscopy services where I have to apply medication for patients to put them to sleep to be able to do the procedure.
Mm-hmm.
And then taking care of them after the procedure, right? So that was for about almost 3 years in a public hospital and then in a private practice, which was very interesting because we did different kind of endoscopy procedures and some of them trying to figure it out if the patient was having cancers by doing biopsy and sending them to the lab, right?
Mm-hmm.
Later on, I went to work for a Canadian company in Peru for a group of geologists and then also other engineers, right?
Mm-hmm.
And some Peruvian workers that were helping those geologists. So I was the only nurse to take care of 50 people. And the reason why they decided to do that is because the closest hospital was a few hours away. So they wanted that in case of any emergency, the patients will be able to get the first aid until I will be able to take them to the hospital, which happened several times. And we have to drive to the hospital, but giving the first aid to the patients.
Right.
And later on, when I came to Canada, right?
So I understand that lots of people think that most of the health careers only exist in hospitals. And so you worked in a hospital, but later on you chose to work in a different part of healthcare. So how was your experience at the hospital, and how did you realize that wasn't the right choice for you? And yeah.
Because when I came to Canada, the only way that I was able to start being a nurse, start being recognized as a nurse, is just to show that I was able to work at the hospital. That was the only way to get the experience. While I was still so new for the system and I didn't know how to get into the community, which was my passion. So my only opportunity was to work at the hospital, which was really great because that gave me a lot of sense of autonomy and security and independence. It was challenging, it was tiring, but at the same time, it was rewarding with knowledge. Although there are times that, patients come and they can stay for longer periods of time. So since I was growing up, always I was thinking how to prevent things, what you can do to avoid that the person become ill or becomes in the hospital, or for example, like what to give to kids so they don't become ill with, for example, immunizations. So that was my thought thinking at the hospital, even though it was rewarding, but also the shorter time that you have to spend with the patient because they require so many needs and you were not able to spend quality time with them. And sometimes the time that you only spent was giving them medications or giving them a bath. Not even spending time with their family because you have to run for the next patient, especially if you are doing surgical procedures.
Yeah.
So then I was thinking, now that I'm really well prepared, I would like to try public health.
So you were like inspired to work in the community because of your experience in the rural area of Peru?
Yeah.
Okay, I see. So after that, you moved to Fraser Health, public health unit, and how did you get to that job?
So it took a lot of persistence and sending a lot of application. At that time, it was using fax and calling the managers for different health units to mention that I'm a nurse and that I'm interested for an interview, that I have experience in community and I would like to work as a public health nurse. Because I didn't, know where to start, the only thing that I realized is, okay, look for all the phone numbers of public health units and just start calling them. And trying to update my resume and just sending them. So it took about 6 months of doing this until one day I got a call from a manager from Vancouver Coastal Health that she was finally interested to give me the opportunity for an interview since I was persistent, leaving her message.
So, as an immigrant, it's very difficult to find a professional job here, but persistence gave you that opportunity. And would you say the entire process was rewarding in the end? Like you like what you're doing now and everything?
Yes, at the beginning I was afraid because I wasn't so confident with my English, with my language, right? Being an immigrant, and I didn't know too much about the culture, which I have to try to understand and be a nurse in Canada, how a nurse in Canada can think. And knowing that community here was very independent, and you also have to be very creative in public health. So after the first step, I think it became easier, and also knowing that they were giving you the opportunity to learn, to go to conference, to have material available to learn more if you wanted to learn more about communicable disease, about different kinds of immunizations, about how to run a school blitz, about how to learn more regarding breastfeeding. So after all those years, basically 14 years in public health, I think I enjoy every day I was there or I am there, because it's what I like, prevention a lot, and if you can pass the proper knowledge to the client, by changing one person, you can change the whole family, and the whole family can change a community. So by giving the best of you and preventing so many things that it's not only about immunizations and breastfeeding, goes beyond that, even regarding attachment or child development, or how to even get the proper treatment when the child has a learning disabilities, where to do the referral, and finding resources in the community that can support that mom, especially if they have vulnerabilities. I think I make my dream came true.
Thank you.
You're welcome.